Hello and welcome to my presentation. I'm Stacy Breik. I'm a licensed practical nurse and I'm here to talk to you about an exciting opportunity for Grace Cottage Hospital. We all know there's a nursing shortage, so we need to aim to attract quality staff to our hospital and retain the nurses we have. The most successful and cost-effective way to do this and to compete with other hospitals in Vermont is to develop a nurse residency program. With your help, we can achieve this as soon as 2025. So here are some topics we'll be talking about today. What's the issue? What's going on at our hospital that a program like this is necessary? How do we solve this issue? How much will it cost? And how will Grace Cottage benefit from the development of a nurse residency program? The first issue I'd like to talk about is financial need. Studies have shown that implementing a program like this one can accrue a total net savings of up to $10 to $50 per patient. Developing a new program costs money, but in the long term will save our hospital a lot of money. Just the expected decrease in staff turnover from this program can save $600,000 per year. And I love this visual because we are putting money forward this year, but it's a long-term investment in creating a quality hospital in our town. The second issue is nurse competency. New graduate nurses are expected to be competent in most areas of nursing, and these expectations can be unrealistic, leading to new nurses feeling unnecessary stress and inadequacy. New nurses who are stressed and overwhelmed don't practice as competently as they should. The best thing we can do for our new graduate nurses who choose to work at this organization is to develop a nurse residency program. Studies show a designated time of transition from learning theory in school to practicing it clinically improves quality of care and safety. The third issue we have here is staff turnover. A new nurse leaving a hospital within a year can cost up to $75,000. So when we hire a nurse, we need to keep them happy. Low retention leads to low patient satisfaction, and high turnover in nursing can actually increase the likelihood of patients dying. That's how important this issue is. We have got to recruit a full nursing staff and keep them happily working here. There's no reason for our facility to continue using a traditional staff orientation period when studies show a residency program provides, again, a net savings of $10 to $50 per patient. Having a residency program for nurses is very likely to increase confidence and competence of nurses as well as reduce turnover. So just how is a nurse residency different from a traditional staff orientation period? We'll be hiring 6 new graduates to begin the program June 30th. These 6 adults will have each other to lean on through the 6 months of their new career, as well as their nurse mentors. They'll be working and job shadowing 32 hours a week while also receiving 8 hours per week of paid additional education. The mentorship process will be job shadowing and then gradually reduced over 6 months until these nurses are feeling confident as nurses. As I mentioned in the previous slide, we'll be providing education for these nurses as residents in this program. So in order to provide additional education to these residents, we'll need some teaching supplies. A wound simulation would be helpful, as well as a training mannequin. This way we can run medical simulations for the students to practice responding to. And we'll also be covering special topics, such as diabetes care, congestive heart failure care, labor and delivery, wound care, palliative care, etc. And other special topics may include nurse bullying, violence in the workplace, and therapeutic communication. As program developer, I'll be working 20 hours per week over the 2025 year to develop and implement this new program. This will include developing a curriculum for the program, hiring appropriate candidates for the residency program, overseeing the success of the participants, overseeing the success of the mentor nurses, developing and scheduling training programs weekly, and leading productive discussions among participants to enhance learning. Also, several experienced nurses will need to step up as mentors for the success of this program. These nurses will be given an additional $5,000 a year to take on duties outside their nursing role. Those include establishing a therapeutic relationship with a resident participant, effectively teaching nursing skills while maintaining patient safety, providing safety oversight while new graduates perform new skills, and meeting regularly with myself and the participants to evaluate success. I'll also be approaching several medical professionals throughout the hospital to assess interest in leading a class in the residency program. Input from every level of the medical team would be helpful for these new nurses to hear from. Classes could be about specific skills, working with special populations, self-care, team building skills, diversity training, just some ideas I've come up with so far, any topic that people are passionate about and think could be beneficial for people just entering the medical field. Given the salary changes and materials needed to implement this program, it does appear to be costly. $68,000 is a lot of money. But remember that when a new nurse resigns from a facility within the first year, the hospital loses about $70,000. So retaining just one nurse from the residency program could offset this entire startup cost. So again, the benefits of creating a nurse residency program for this hospital are huge. And studies show time and again that nurse residency programs work. They help retain staff, they help train staff, and they help new nurses feel confident in their role. I think that is exactly what Grace Cottage is missing. I think we can compete with other hospitals better if we have something like this to offer. Again, net savings of $10 to $50 per patient. So each year we'll have money to buy more educational materials. We'll have money to pay classroom teachers to come instruct these students. Every year we can improve this program because there will be money to do that. It increases staff confidence, it increases medical competency, it reduces turnover rates, which in turn keeps patients happier, healthier, safer. That's the goal. I mean, if we want to be a competitive hospital that treats our patients well and treats our staff well, a program like this would be a great step. And financially, it's a no-brainer. It's super cost-effective after the first year. That concludes my presentation. Thank you.